People commonly categorize depression into one of two categories: clinical depression, which requires treatment, or normal depression, which can affect just about everyone. Sometimes it can be challenging to understand depression as a condition. But what is depression? Depression is characterized medically as a mood disorder that often results in a significant loss of interest in activities that usually give you joy and a chronic feeling of sadness or depressed mood. Depression has an impact on how you feel, think, and act, which can make it difficult for you to function and go about your daily activities. Depression has a wide range of causes, some of which we still don't fully comprehend. The following are 7 of the most prevalent kinds of depression. Major depressive disorder. Major depressive disorder is typically meant when individuals use the term clinical depression. Major depressive disorder has several distinctive signs, including: you might feel down, you have a lack of interest in normally enjoyable activities, you experience weight and sleep changes, you feel tired, you experience feelings of guilt and worthlessness, have difficulty paying attention, or having suicidal and death-related thoughts. Persistent depressive disorder. Persistent depressive disorder is a form of chronic depression that can last for at least 2 years. It can vary from mild to severe. There may be brief times when a person does not feel depressed, but the symptom relief only lasts 2 months or less. Although the symptoms are numerous and lasting, they are not as severe as those of major depressive disorder. Persistent depressive disorder comes with these signs. You feel sad. You experience loss of enjoyment and interest. You feel irritated or angry. You feel ashamed. Have low self-esteem. You experience changes in appetite. Bipolar disorder. Manic episodes, often known as mania, are a symptom of bipolar disorder. These episodes can vary from mild hypomania to severe enough to significantly impact a person's life, require hospitalization, or interfere with their perception of reality. Most people who have bipolar disorder also experience major depressive disorder signs. People with depression often experience a number of physical and emotional symptoms, which may include a depressed mood and noticeably reduced interest in activities. You may experience sleeplessness and tiredness, pain and mood swings that are not explained, lack of optimism and diminished self-worth, irritation and anxiety, indecisiveness and disorganization. People with bipolar disorder are 15 times more likely to attempt suicide than people without the disorder. In more severe situations, psychosis, which includes hallucinations and delusions, can also happen. Postpartum depression. Significant hormonal changes associated with pregnancy can often have an impact on a woman's mood. Depression may start during pregnancy or soon after a child is born. After giving birth, mood swings, anxiety, irritability, and other symptoms are typical and may last for up to 2 weeks. The symptoms of postpartum depression are more severe and persistent. These signs may include: you feel sad, you have extreme mood changes. These signs may include: you feel sad, you have extreme mood changes, social isolation, experience problems developing a bond with your child, feeling hopeless and helpless, feeling unworthy, experience panic and anxiety attacks, having thoughts of injuring your baby or yourself. The disease might continue up to a year if untreated. Fortunately, studies have shown that remedies included hormone therapy, counseling, and antidepressants can be efficient. Premenstrual dysphoric disorder. Premenstrual syndrome symptoms include irritation, anxiety, moodiness, bloating, increased appetite, food cravings, pain, and breast tenderness. Some other signs of premenstrual dysphoric disorder include extreme tiredness, feeling sad, hopeless or critical of yourself, experience severe stress or anxiety, inability to pay attention. Seasonal affective disorder. Seasonal affective disorder, also known as major depressive disorder with seasonal pattern, is a condition where people experience depression, sleepiness, and weight gain throughout the winter, but feel fine in the spring. Seasonal affective disorder is thought to be brought on by a disturbance in the body's typical circadian cycle. Any seasonal difference in the night-day pattern can produce a disruption, which can contribute to depression. This rhythm is influenced by the light coming through the eyes. Seasonal affective disorder is more prevalent in the planet's extreme north or south, and it is usually treated with light treatment to make up for the seasonal loss of daylight. Atypical depression. Do you experience signs of depression such as overeating, sleeping too much, or extreme sensitivity to rejection, but find yourself suddenly perking up in face of a positive event? You could have atypical depression. The symptoms of atypical depression fall into specific category and include: you overeat or gain weight, you oversleep or feel weak, you experience extreme sensitivity to being rejected. If you or a loved one are struggling with depression, please reach out to someone you really trust or to a professional. If left untreated, it may interfere with your life and get more severe. If you think this video helped you, please like and share with those who need it. And don't forget to hit the subscribe button for more videos. Thank you for watching, and I will see you next time.